One of my favorite things to do is to help bond dentists together. This is Paul, Dr. Nacho Goodman. I am the founder of Dental Nachos and Dentist Job Connect. I'm a practice owner with my brother in Pennington, New Jersey, and we have awesome associates working with us. One day, way back when, I guess almost now 20 years ago, I was an associate too, working for my dad. So I know how difficult it is to start in a practice as a new associate. What I want to do is deliver some value to you, ask you a few questions, get you thinking. I have one of my favorite books here at all times, the Checklist Manifesto, that I'd like to show you. I can't seem to find it right this second, but the Checklist Manifesto is one of my favorite books. Another amazing book is the E-Myth Revisited. The E-Myth Revisited, get the Checklist Manifesto and the E-Myth Revisited, two awesome books that will help you in your practice journey. But what can I share with you to help you improve efficiency, to help improve the relationship between the practice owner and the associate? So let's just think we have a new associate in a practice, super motivated, joining the practice of a medium-aged dentist. And some of the things that we want to talk about are, how can this associate be efficient, increase speed without compromising quality? So a common challenge. One of the things that's important for practice owners to understand is all these patients are new to the associate. So you may have known Millie for the past 14 years, but your associate's meeting Millie for the first time. That makes things take longer because the associate must develop relationships with the patient personally. So just be aware that that's normal for things to take a little bit longer. But what are some things associates can do? And let's talk about a single tooth crown on number 30. One, plan the procedure before it starts, okay? Create a checklist with you and your assistant. First, we are going to take an impression and make it temporary. Anesthetize the patient. Is that the order you want to do? Maybe anesthetize the patient first. While they're getting numb, you can take that. So break down each major step in the procedure. Make a checklist for you and the assistant. If there's hygiene checks to be done, plan those hygiene checks strategically. Say with your hygienist, hey, when I anesthetize this patient for my crown, I'm going to do the hygiene check in the middle of the exam. Just make sure the x-rays are done if that's important to you to see. If the x-rays aren't done, maybe you see the x-rays before the patient goes, but strategically plan your hygiene checks so that you are not creating a bottleneck or a molasses type crown